right, good morning.
Good morning.
How are you today?
Good, and you?
Pretty good. So my name is Mariani Morales, or I go by Mariani as well. Okay. I am a dentist. I'm working in Quincy Community Health Center in a really tiny town, Quincy, Washington. It's like the super center of Washington. I grew up in Yakima, Washington. My parents are farm workers, so growing up we depended a lot on health centers. I knew I wanted to do dentistry to be able to come back to these rural communities and make a difference in other people's lives.
Hello, hi Charles.
How are you?
I'm good. A majority of the people we see are Medicaid or have no insurance. So for a lot of people, if we weren't here, there really wouldn't be many other options. We're a lot of people's last resort. I'm gonna lay you back.
We extracted 2 teeth 2 weeks ago. If we don't have a dentist here locally, then we've got to travel 30, 40, 50 miles to get to a dentist. If you're in pain, if you've had some kind of complications, whatever, that you don't need an ambulance, that's a long ways, long ways.
There are times where it's hard to get providers to work out here.
People would come to big cities to get trained to be physicians or dentists, and then they wouldn't leave.
Just kind of follow me with the surgical section.
RIDE stands for Regional Initiatives in Dental Education. It's really a track at the School of Dentistry. A RIDE student does their first year in Spokane. It's basically a way of placing the students out in Eastern Washington and then also in rural and underserved areas across Central and Eastern Washington. We're working on expanding the program and expanding it to rural and underserved areas in Western Washington.
Good job, good job, good job.
I was looking into a dental school that offered an emphasis on rural and underserved areas. And I grew up in a Hispanic household, and my parents, they're window cleaners. Ultimately, my biggest goal is to have them as my first patients. I'm a first generation to go to college, and first generation, hopefully, to graduate from dentistry. So hopefully be moving to Okanagan. So that's the plan.
Dentistry is important for a lot of reasons, and really it affects someone's whole well-being. Things look really good, so I'm glad that healed up really nicely. So I like the feeling of a small town, the community. You just get that sense of community, even being in the clinic. I do see a lot of my patients at the grocery stores, at the coffee shops. It's a good feeling knowing that you're making a big difference, and I think that it is doing great things to be able to come back to these rural communities and make a difference in other people's lives.